like to adjust your video settings accordingly. We've pinned everyone, but feel free to take a moment to adjust what you need to now. We also have the Spanish language option available if you want. Right, we'll give it one more second to get everyone in. I said this before, but I will say it one more time for anyone who just joined, that we have the Spanish language option available if you want to swap out your language preferences. As well, we have ASL if you want to adjust your videos accordingly, and we have them pinned, but if you want to make any adjustments on your end, please feel free to do so now. And with that, we'll go ahead and get started. Thank you for joining us today for our COVID-19 update. With us, we have, too many clicks, Dr. Rachel Herlihy, State Epidemiologist for CDPHE, Scott Bookman, COVID-19 Instant Commander for CDPHE, and Scott Sherman, our Brigadier General. And we're going to start with Dr. Rachel Herlihy.
Good afternoon, everyone. So starting today with our case data, as always, you can see our 3 waves of illness, our smaller spring wave of illness, our very small summer wave of illness, and then now our much larger fall wave of illness. And if you look to the far right of this figure, which you can see here in our overall 7-day average number of cases, is that we really have continued to see this downward trajectory for the number of cases occurring in Colorado. This is clearly good news. As many of you, I think, know, we did manage to avoid a significant spike associated with Thanksgiving here in Colorado. That same experience was not universally seen across the country. And Scott is going to talk a little bit more about what hospitalization data looks like across the country right now. But clearly, we've done well in Colorado. We've been able to bend the curve and lead to this declining trajectory for the number of cases. But I would remind you that, the number of cases that we are seeing in the state right now are still really high. The number of cases we're seeing right now, based on that 7-day average, is equivalent to what we were seeing in the state in early November. And based on our current trajectory and the level of transmission control we have right now, we anticipate that it's still going to be a couple more months, probably 3 months or so, 2 to 3 months, until we get back down to where we were this summer. And that's, again, if we can stay at the place where we are right now with transmission control and we don't see a spike associated with Christmas and New Year's. So again, keeping in mind that the rates continue to be quite high. We need all of the strategies that we've been using in the last couple of weeks to control this virus, to continue to control the virus as we move further into the winter. Next slide. And this is a slide that shows you our 7-day average of deaths by date of death in the state. If you remember last week when we shared this data, we had not yet seen a decrease in the number of deaths that were being reported in the state. But as of late last week, we have observed now a peak in the number of deaths that have occurred in the state and have had several days now of a declining trend in deaths occurring by date of death in the state. So this is more good news that we are seeing a declining trend in deaths, sort of our most severe outcome, of course, due to COVID-19 in the state. And with that, I will turn it over to Scott to talk about hospitalization data.
Thank you, Rachel, and thank you to everybody for joining us this afternoon. On this slide, you will again see our three peaks, which are consistent with the three waves of illness that we have seen across Colorado in 2020. Our first wave in the spring, where we saw a peak simultaneous hospitalization of 888 COVID patients. You can then see our second spike here in the center in July, where we peaked at 275 COVID hospitalizations. And then all the way to the right, you can see our peak, which was on December 1st, where we peaked at 1,581 COVID hospitalizations. You can see the really remarkable downward trend here. And as today, we are at 1,222 people hospitalized with COVID. And so, that is a dramatic downward slope, and we are glad to see that happening. I think it is crucial to remember that peak, where we are today is still well above where we were in the spring, and that our hospitals, our healthcare providers are still feeling incredible stress from the amount of patients who are currently sick and hospitalized with COVID. As we go into the holiday week here, I do want to extend my personal gratitude for all of our healthcare workers for all that they have done for us throughout 2020. They will be working around the clock over the holidays to care for those who are sick and hospitalized with COVID. And I think we really look at this graph and think about, we've made a lot of progress, but we still have a long way to go, and we still have a lot of COVID in our state right now. So next slide. So for those who also pay attention to the national news, we know that over the course of this fall, hospitalizations across the entire country have really been skyrocketing. We hear very scary stories about running out of ICU beds and other hospital beds in different parts of our country. And you can see here on the green line how Colorado really diverged from that. And we peaked earlier and have come down quite dramatically since November. And you can see the rest of the United States is continuing to trend upwards. So I think this really speaks to how all Coloradans have come together to really follow our public health guidance and to make really good choices, particularly around Thanksgiving, on how we curb the spread of this disease over the last few weeks and as we go into New Year's Eve as well. Next slide. And so, here are our winter holiday tips. Over the Thanksgiving holiday, we did not see a large bump in cases. Many other states across the country did see a large bump. And that credit is due to the actions that all Coloradans took to mitigate the spread of disease over the Thanksgiving holiday. And so we're asking everybody to follow that guidance again with the remaining winter holidays. And so, three really key things to remember. Only interact in person with people from your household. Refrain from traveling this year. This is our year that we've learned to live on Zoom. Celebrate virtually with the people who don't live with you. And we want to encourage people to shop local in Colorado, but do as much of that shopping as you can online so we can avoid crowded stores and can avoid the spread of disease. We have other tips for how to safely celebrate the holidays on our website, and we would encourage everyone to go over there and take a look. And again, we just ask everybody to let's work together and make sure that we keep COVID rates low in the coming weeks. And I will now pass it over to my colleague, Brigadier General Sherman, to talk about vaccine.
Hey, thanks, Scott. Hey, good afternoon, everyone. I'm Brigadier General Scott Sherman from the Colorado National Guard, and I lead the Colorado Vaccination Distribution Task Force. So the slide you're looking at really shows you the distribution of the 95,600 doses of Moderna that we've either received or are receiving this week. With this allocation, 151 facilities around the state are receiving the Moderna vaccine. Currently, we've received 95,100 of those doses and expecting the other 500 are delivered today. We're actually tracking those. Some great news. Of the over 50,000 doses of Pfizer vaccine that we received last week, over 42,000 doses have been administered as of late last night. So really, a thank you to the hospitals, clinics, local public health agencies in being so proactive in vaccinating our frontline healthcare workers. It's really been spectacular, the results we've gotten there. I also want to give you an update for the vaccination allocation for next week. Right now, we're projected to get delivery of 32,900 doses of Moderna. And then next week's Pfizer allocation is projected to be over 51,000 doses. Now, of that 51,000 doses, over 36,000 is being given to the CDC Pharmacy Partnership for Long-Term Care Program. So we'll get about 15,000 doses in the state that we will ship out to providers. So in Colorado, the CDC Pharmacy Partnership for Long-Term Care is being administered by both Walgreens and CVS pharmacies. So good news is both CVS and Walgreens have already received their allotment from last week and this allotment. So they're scheduled to begin vaccinating our skilled nursing facilities as early as Monday, December 28th. So that's a really great news that we'll get going on that and really start vaccinating our most vulnerable population. Next slide, please.
Great. And so with that, we'll go ahead and start our Q&A portion of the presentation. To do that, we will use the raise hand function. So if you want to go ahead and do that, then I will call on you. And if you could say which outlet you're with and your name, that would be great. I would also say if you have any questions about anything other than kind of what we talked about today, you can send those over to media_info@state.co.us. And with that, we'll go ahead and start with Meg.
Hello, this is Meg Wingeter from the Denver Post. With the vaccine allocations, this week with this coming allocation, is Colorado going to be getting what was expected, or was there also a reduction again this?
Actually, no, because there really wasn't. We were not expecting Pfizer vaccine this week, but they did send us a little over 31,000 doses. So that was actually unexpected, and a good portion of that went to the skilled nursing facility for the CDC pharmacy program. But actually, that was a surprise. And then, no, we're on track, and we're actually receiving 3,000 more doses than we originally thought we would get this next week.
Thank you.
Great, thank you. Aaron Prater, we'll take it over to you.
Sorry, can you hear me now?
Yes, we can.
Great. Okay, this is Erin Prater with the Gazette in Denver and Colorado Springs. I'm wondering what you can tell me about these mutant strains that we've been hearing about. There's one in the UK, and I believe one that is evolved in South Africa too, that sound like they're more transmissible. According to the CDC, as of yesterday, there was no record of them reaching reaching the United States, but it is possible. Is the state health department sequencing for these strains, and do we know if they've arrived in Colorado? Also, what is the most recent forecast for deaths due to COVID through the end of the year? Thanks.
This is Rachel. I can take those questions. So the new variants that have emerged in the UK and South Africa do appear to be more transmissible than other strains of COVID-19 or SARS-CoV-2 virus that have been circulating across the globe. But what we understand so far is that it doesn't appear that these strains, these variants in the UK and South Africa are causing more severe illness. We also don't have any indication at this time that the vaccine would be less effective against these strains. So, I think there's quite a bit we still need to learn about them. As CDC has said, these strains have not yet been detected in the US, but it's quite possible that they are here. We know that things, as we learned with COVID in the spring, we know that virus can travel rapidly with international travel. So it's certainly possible that they are here and just haven't been detected yet. Both CDC and the CDPHE lab are doing enhanced work to do the sequencing work to look for these strains. Again, we haven't found them yet, but we are going to be looking and enhancing our surveillance and working with CDC and sending them isolates also to support national surveillance efforts. To your second question about updated forecasts for number of deaths by the end of the year, I don't have that number in front of me, but we'd be happy to get you that number offline.
Great, thank you. Steve, we'll take it over to you.
Thank you. Steve Steger from 9 News. Question really probably for either Scott or Scott about vaccine distribution. We've gotten some questions after a few law enforcement officers were vaccinated yesterday. Is there a delineation between phase 1A and 1B? Are those all ongoing right now? And how do you make the decision to move between 2 phases? And then a question for Rachel. We heard you, both you and Scott, discussing that Thanksgiving bump. What makes you confident that people followed the rules during that time and that was the reason for success?
You want me to start, Scott? I can start. So,
Go for it.
hey, so, we've talked a little bit about the problems that we have with, I wouldn't say problems, but really constraints that we have with the Pfizer vaccine or any of the vaccines once the vial is punctured. So the guidance we've been given to local public health agencies is, for the Pfizer vaccine, have 6 in line to administer the vaccine, because once you puncture that vial, you really have 6 hours to use that vaccine because it's out of the refrigerator. So we want to make sure that even if it's phase 1 or 1A or 1B, that you at least have that those people in line, because a shot in the arm to anyone in those phases is certainly better than a wasted vaccine.
Yeah, and just to add on to that, this is going to be a somewhat fluid process. We're unlikely to, complete 1A entirely before we move on to 1B. It's a 2-dose series. And, as we allocate vaccine down to the local level, we really do leave some of this decision-making, some of the discretion up to our local public health, our hospitals, to really make sure that they're vaccinating the people in their communities that need it the most within, the boundaries of the phasing guidelines that we've put out there.
And to your second question, I think what we are really looking at when trying to understand, why we did not see a big spike following Thanksgiving is, what was in place leading up to Thanksgiving and really what sort of outcomes we observed. And so I'd say a couple of things. First, that we know that a number of policy strategies, communication strategies were implemented leading up to that Thanksgiving holiday. We had a number of counties that moved to the red on the dial. If you look at data specifically for those counties that moved to red, you can see a clear temporal correlation with when they started to see a decrease in cases occurring. But I would also say that, all of those policy strategies and communication strategies that public health and the healthcare community are using really go on to result in changes in individuals' actions. And that's those changes in individuals' actions that lead to decreased disease transmission. And, we don't have a ton of objective data that really tells us specifically, this number of people gathered and this number of people did not. But we do have some objective data, and some of that data comes from mobility data. So we have specifically CDOT data that these traffic counters across the state that can tell us how much traffic is out there. And we can look at the amount of traffic in 2019 for Thanksgiving and compare that to this Thanksgiving. And we did see some differences there. So we do know that, Coloradans' actions changed. They did things differently this Thanksgiving than they did last Thanksgiving. It's tough to quantify that exactly, but we do believe that qualitatively, at least there was a difference. And now that difference and that change in Coloradans' actions is directly what led to us not seeing a big spike. I think it's also important to recognize that many states did see this big spike. And I think that perhaps I don't know if the messaging wasn't as clear in those other states or was different, but I do want to applaud Coloradans for the actions that they took that really led us to be in the good place we are right now.
One brief follow-up for you, Rachel. Is there a perception concern that people may see this as a success and ease up on things around Christmas time?
I'm hopeful that people recognize that we were able to do this for Thanksgiving and we can do this again. And if we're able to do this again, we can position ourselves to successfully open schools in January and really set ourselves up for a much more hopeful spring. Really, our fastest way out of this is to maintain the levels of transmission control we have right now. So to put it into some numbers, right now we're at a transmission control level of 82%. And if we can stay at this level at 82%, we can get back to where we were this summer, the levels of disease we saw this summer by mid-March. If that transmission control drops to around 70%, it really takes us at least until June to get back down to those numbers. And so, I'm hoping that Coloradans can recognize the fact that what we did over Thanksgiving worked. If we do it again, we can really be in a much better place much sooner than if we don't.
Thank you very much.
Yes, thank you. And now we're going to take it over to Patty. And if you could say which outlet you're with.
Hi, this is Patty Nyberg with the Associated Press. Going off of the previous question about phase 1A, 1B, is it the case that 1B or people in 1B are already getting vaccinated, like correctional facility workers? And if so, is that going along with the plan since they're in 1B and we're supposed to finish 1A, or is it fluid? Can you go into that?
So, first, the updated guidance from the CDC and the Advisory Committee on Immunization Practices came out last weekend, and we are working at the state level on harmonizing our guidance with their guidance. And so nothing will change in 1A, right? That prioritization is still all about those who are most vulnerable as our healthcare workers, in our ICUs, in our ERs, and then also those who are most vulnerable in our skilled nursing facilities and our long-term care facilities. Again, it will be somewhat fluid as we digest that updated guidance from ACIP. We will likely update some of our guidance with a little bit more granularity in phase 1B and really look at how we parse that out to do the most good we can with the small amount of vaccine that we have receiving in state early on. So we'll continue to evaluate that and we'll release that information as we get it.
And if I could just do a follow-up. So we got information from a correctional facility worker that they started vaccinating workers there today. So is that following the guidance?
So, there are clinical providers, there are doctors, there are nurses who provide clinical care in our correctional settings, and they would be part of 1A as clinicians doing high contact COVID work.
Great, thank you. Now we'll take it over to Chris, and if you could say which outlet you're with.
Chris Vanderveen with 9 News. I have 2 questions that are a bit of follow-ups on what has already been asked, but first question is, it does seem we've heard from some primary care physicians who are not getting vaccinated yet, and some people who are not patient-facing are. Is the hope that the Moderna vaccine will sort of eradicate some of the issues, logistical issues that you have with this in terms of forward-facing, patient-facing personnel getting vaccinated, one? And then my second question is in regards to the regionality of this. It does appear while Colorado is doing well, so are a lot of other states that are around us that saw that immediate spike. Is there an idea that maybe we're too reliant on the hypothesis that this is all based upon human activity and maybe there's some regionality and some seasonality that's involved in what's going on here, that irregardless of what humans are doing, the virus is doing something else? Is that possible, that it's not all just because we're staying distant from each other?
I can start out with the vaccine portion. Yes, you're correct. With the 95,600 doses that we received, we'll actually finish up receiving them today. Yet, what makes Moderna so much easier is it can be kept at 0 degrees, regular freezer, and we can ship it in as small quantities as 100. So that's 10 vials. So that's certainly for our more smaller facilities or more remote areas. That's what we've done, shipped it. And that's why 151 facilities are receiving that vaccine. And that makes it, once we receive the shipment, we have enough vaccine in the state right now to finish up our phase 1A frontline healthcare workers. So that's what we're working on completing and getting done. And then next week, as we already talked about, getting our long-term care facilities, our skilled nursing facilities starting on Monday and starting the vaccination there so we can finish up phase 1A.
Great. Okay. And before we move on, just so we can get through as many of you as possible, if you could limit your questions to one question, and then maybe we can circle back, or you can send the additional questions over to media_info@state.co.us. I just want to make sure we can get through as many of you as possible in the time that we have today. So Vicente, I'm going to take it over to you.
Okay, thank you so very much. My question is about the news that came out that an additional 100 million doses are now going to come from Pfizer, but probably not until the summertime. What sort of impact do you think these additional 100 million doses will have on the state? Will that have a huge impact here? Will it help bring an end to the pandemic here in Colorado?
Well, I'll answer for summer for the 100 million. That'll help us get through phase 3 and get everybody vaccinated and make sure we have enough vaccines on hand to get everybody through their second dose. So it's going to be a huge help. But of course, we got more Moderna coming, and then the other two, Johnson & Johnson and AstraZeneca, which will come into our population too. So all that helps. And really with our goal of as quickly as possible, getting our population vaccinated and getting back to normal.
Thank you.
Great, thank you. Connor, we're going to take it over to you, and if you could say which outlet you're with.
Yeah, hey, my name's Connor McCormick Kavanaugh. I'm with Westward in Denver. So my question is about the Denver Homeless Leadership Council sent the governor a letter recently asking the state to move homeless shelter staff to phase 1 and people experiencing homelessness to phase 2 on the vaccination distribution list. And I'm wondering, maybe this is for General Sherman, should the state do this? And if not, why not?
You want to take this, Scott?
Yeah. So, as I stated earlier, we are continuing to evaluate the updated guidance from the federal government and ACIP to really make sure that our guidelines are harmonized with their guidelines. So we do continue to evaluate that and do anticipate, making some updates in some ways to our phasing. What we rolled out several weeks ago was really focused on 1A, knowing that we would get more guidance and that we would be following up later with guidance for 1B and beyond. We think it's really critical that we look at individual risk factors in who should get the vaccine first, and so those who are over 75 are at extreme risk for bad outcomes with COVID. Those who have pre-existing conditions are at higher risk of bad outcomes from COVID. And then really looking at our frontline workers, those who are at risk because of the work that they have to do in person, rather than so many of us who are able to work from our basement. And so that's where we'll continue to evaluate the best way to vaccinate individuals based on the individual risk that they have, either because of the work that they do or because of any conditions that they may have.
Great, thank you. Zachary, we'll take it over to you if you could say which outlet that you're with.
Hi, this is Zachary Either with KRDO in Colorado Springs. My main question is, in phase 2 that's happening in the spring, one of the guidelines says that it's for people who interact directly with the public at work. Does that include people in restaurants and the retail business?
So again, continuing to evaluate these updated guidelines, and we will have more information coming out in the coming days and into next week on how we plan to approach this. Continuing in particular to really evaluate, who are our essential frontline workers, what is the best way to ensure that we're protecting everyone again, based on the work that they do, and ensure that we use our limited supply of vaccine to save as many lives as we can and to end this crisis as quickly as possible.
Great, thank you. Meg, we'll take it over to you.
Hi, this is Meg from the Denver Post again. I wanted to ask, you specifically mentioned about, in addition to avoiding gatherings and such, trying to avoid stores that may be crowded and shopping online if you can. Is that just general knowing that people do a lot of shopping this time of year, or have you seen indications that there's a lot of spread happening in retail environments?
This is Rachel. I can take that. I think it's probably primarily that there's a lot of shopping that happens at this time of year. And we know that stores are places that can be crowded. There's lots of people interacting there. Some of those activities are, essential, where people might have to go to a store. But we obviously want, whenever possible, for people to minimize their exposure. And so if you can shop online and have things delivered, or we encourage people to shop locally and do curbside pickup. So many stores are offering curbside pickup these days. Those are both good options to avoid that risk of being exposed in a store potentially.
Great, thank you. Chris, we'll take it over to you.
Chris Vanderveen again from 9 News. I want to ask that second question that I asked. I apologize. Can you hear me?
Oh, yep, we can hear you now.
Sorry. Yeah, Chris Vanderveen from 9 News. So second question for you. Are we giving too much credence to the idea that only human activity and a lack of interaction is responsible for the decline of virus activity in the state? It's clear for some folks that what is happening here is regional. We're seeing a lot of states that are going down at the same time in our region. And that has led some people to believe that there is more than just social interaction that's at play here, that there's some regionality and maybe some seasonality in what the virus does. It's a long-winded question, but I'm basically asking, is it possible that something else is at play here with the virus and not just restrictions and people just doing the right thing?
Yes, I think certainly there is likely some seasonal components to transmission of this virus. We see that very commonly with other respiratory viruses. So I would not be surprised if as we learn more about this virus, we learn more about seasonal aspects of transmission of this virus. And some of that is going to be because when the weather cools, we start to see people move indoors, and we know that this virus and other respiratory viruses are more efficiently transmitted in indoor environments. But there also are just weather, climate factors that can change how viruses are transmitted. We often know that with respiratory viruses, we see more efficient transmission in cooler weather, in when there's less humidity. So certainly that is all possible. One of the things that we did note in the early fall is that we started to see increasing rates in some north sort of central states in the US. They clustered together, and it's difficult, I think, to know with certainty if that was because of seasonality, human behavior, or other factors. But I think the reality is we have a lot more to learn about this virus. Certainly human behavior and human interaction is a major driver of transmission, but there probably are other influences as well, including seasonality.
Great, thank you. All right, one last question. Vinny, if you could say which outlet you're with.
Hi, it's Vinny Del Giudice at Bloomberg News in Denver. On the supply chain, after this recent surge in hospitalizations, how is the state doing as far as medical supplies, PPE, ventilators, and this type of thing? And as far as the supply chain with vaccines, we're getting enough drugs, but how about ancillary supplies like needles? Will needle manufacturers, for example, be able to keep up? Thank you very much.
So as far as the hospital and the healthcare supply chain goes, things are still tight. we have not returned to where we were in a pre-COVID world. That being said, we are in constant communication with our hospitals, with our healthcare providers, and at this point, they're still, using strategies to conserve their PPE, but they are not at a point where they are seeing critical shortages where we were in the spring. We do also monitor the amount of ventilators that are in use and available across the state each day, and we do not have any concerns about ventilator capacity at this time. For the immunization question, I'll pass it over to General Sherman.
Yeah, so for ancillary kits, actually warp speed's been great on getting those delivered. One thing we have seen is since we're getting a 6th dose out of the Pfizer vaccine, there have been times that we run out of needles and syringes. What we've done at the state level is we've actually ordered those and put those in our warehouse. So if we do have ancillary kits that aren't delivered, or if somebody's experiencing a shortage, we'll get those delivered to them. But so far, we've had no shortages on those supplies needed to administer the vaccine.
Great, thank you. And so with that, I want to thank our panelists for today, Dr. Rachel Herlihy, Scott Bookman, and Brigadier General Scott Sherman. And I also want to thank our interpreters, Teresa and Sherry, for providing their services, and thank all of you for joining us. And with that, I will say happy holidays and thank you, and we'll see you soon.